So, how does chronic inflammation infection happen? Two types of immunity, innate and acquired, can have defects. Immune defects alone result in illness like hypersensitivity and autoimmune diseases. Hypersensitivity is an overactive immune response. Autoimmune is inappropriate reaction to self. Inflammation is often the result of the body's normal response to infection. It's how the body controls and eliminates pathogens. Inflammation usually occurs in a tissue following damage or other harmful stimuli. While acute inflammation generally subsides quickly, malfunctions in immune regulation are linked to various chronic diseases. This may include eczema, psoriasis, rheumatoid arthritis, inflammatory bowel disease, asthma, hardening of the arteries, and heart attack. Although all the mechanisms of chronic diseases are not clearly understood, they are often linked to long-term production of the inflammatory mediators mentioned earlier. Again, interleukin 1, interleukin 6, or tumor necrosis factor, along with the presence of cells of inflammation. When infection happens, a foreign organism enters and wants to grow inside the body. In the process, it causes the symptoms of disease. The body responds to this in the above-mentioned ways. Certain organisms, like virus, can remain within the host cell without being eliminated. Severe, acute, overwhelming infection can cause a large accumulation of toxins that cause sepsis, which is life-threatening. All cells have organelles called lysosomes. Lysosomes remove and digest waste and toxins. This is called autophagy. This is a target for research for inflammatory disease and infection. One modern way to treat chronic inflammatory disease is by using medicines that control the inflammatory response, known as immunomodulatory therapy. These work in different ways, but they have greatly improved the way we treat rheumatoid arthritis, inflammatory bowel disease, and psoriasis. A different approach for health preservation is integrative medicine. This is the combination of conventional medicine with complementary and alternative medicine in an attempt to boost the effects of both and optimize patient care. Integrative medicine focuses on treating both the body and the mind. Traditional Western medicine is substantiated by scientific methods and evidence-based clinical research. Integrative medicine relies on treatments that are associated with certain benefits for health management that date back to ancient times from places like Asia, Africa, and the Middle East. Modern science continues to investigate these non-traditional methods, some of which are helpful to immune function and other fields of medicine. Studies have demonstrated the role of complementary and alternative medicines in providing effective protection from inflammatory diseases. As mentioned earlier, inflammation can occur due to various reasons, such as infection or injury. In the process, the cytokines, chemicals, are released for control and coordination of these reactions. Herbs such as Astragalus, Angelica sinensis, or DBT have been shown to decrease allergic-type antibodies and cytokines. Studies have also shown that pomegranate peel extract could reduce inflammatory reactions, generation of reactive oxygen species, and secretion of inflammatory mediators. We have to be careful about running out of antibiotic medicine. Germ resistance is a danger. Allopathic medicines are in a struggle to treat patients for the simplest of health problems, and this is where the use of integrative therapies can be of substantial importance. During the COVID-19 pandemic, did you know that doctors suggested using integrative medicine strategies to boost the immune system and reduce the duration of the disease? These include healthy lifestyle changes, which are adequate sleep to ensure the maximum secretion of melatonin that combats the virus, reducing physical and psychological stress through mindfulness techniques, meditation, breathing exercises, and guided imagery, consuming fruits and vegetables and vitamin C to enrich the diet with antioxidants, antimicrobials, and anti-inflammatory molecules. In summary, When we think of the immune system, short-term elements like the common cold or flu often come to mind. But the immune system plays a far more extensive role in our health, such as autoimmune diseases like MS, lupus, rheumatoid arthritis, and possibly fibromyalgia. These are linked to errors in the immune system. Almost all chronic diseases, such as heart disease, diabetes, fatty liver, and cancer, are influenced, at least in part, by the immune system because of the underlying inflammatory response. So here's how we can have a 6-part immunity shield. Once again, fruits and vegetables, look into herbs and supplements, get a good night's sleep, limit alcohol, quit smoking, exercise often, and bolster your hygiene habits.